Hello YouTube, this is Dr. Havercorn with River City Oral and Maxillofacial Surgery in San Antonio, Texas. It is Monday night, January 28th, 2019. It's probably about 11:15. Oh, there goes my light. So I filmed a couple of videos earlier today, right when I left the hospital, or I should say earlier this evening, talking about infection and blood pressure in a dental patient. And then I was listening to those videos driving home and started thinking about infection lectures I used to give to the students when I was teaching. And it just reminded me of a few simple questions I used to ask students that a lot of times, and not just students, but younger residents who just couldn't answer these kind of things. So when your attending physician starts asking you questions to kind of see what you know and to see if they can stump you, we always call that pimp questions. So, of course, I called the video late night pimp questions. If you Googled something that brought you here, you might be a little disappointed. Sorry about that. But let's talk about some pimp questions, okay? So when you're a student and you're on rounds or you're in dental school or whatever, you always have the attending that just asked you the most esoteric questions that nobody could possibly know the answer to, because it wasn't a question about your knowledge. It was a question about your knowledge of something that only they would know. Okay, so the classic example is like, oh, student Dr. Havercorn, let me jiggle this change in my pocket. Do you know how much change I have in my pocket? No, sir, I don't. I'm so sorry. I'm an idiot and don't know how much change you have in your pocket. Another question like that would be a professor asking about a huge, broad topic, but they got one little specific thing in mind. And so it might be like, oh, student Dr. Havercorn, I was reading the Encyclopedia Britannica last week, and I came across a very interesting topic. Do you know what it might be? No, sir, I don't. Please enlighten me. But I'll tell you, when I would give my infection lectures, the first thing I just would start the lecture with was I just look at the residents and I'd say, who can tell me what an infection is? And you would be surprised at how many people couldn't do it simply. So I'm going to do that. An infection is inflammation and symptoms, I should say, caused by bacteria in the wrong place. Okay, so a lot of times the residents and the students would talk to me about bacteria, in the tissue or on the tissue or whatever. Well, so here's the thing: I got bacteria on my skin, I've got bacteria in my mouth, bacteria everywhere that is not causing me any symptoms. I'm not infected. My skin's not infected. My mouth's not infected. Heck, you can have bacteria in your bladder for various reasons with no symptoms, and it's not called a bladder infection. Okay? So bacteria alone doesn't make you infected. It's when that bacteria starts to cause symptoms. And there's various methods that happens that's beyond the scope of this video. But there's really two basic group of symptoms that can happen. One is localized inflammation. So in my world, that'd be the person that comes in with swelling down on the neck from a tooth. They got swelling, pain, redness, warmth, all of those signs of inflammation. And then, you kind of put the whole picture together. See, those symptoms are inflammation. But when you combine it with the overall picture, you can say that's inflammation caused by bacteria, therefore it's an infection. Okay, because there's other reasons to have inflammation besides bacteria. So the infection is that symptomatic invasion by the bacteria. And so you can have the localized symptoms, like I said, the inflammation. And the other thing you can have is systemic symptoms. And, it's not uncommon to see patients that have both. But systemic symptoms of infection are going to be things like fever, chills, sweats, just malaise where you just don't feel good. And then if we start kind of investigating a little bit, we're going to see that probably you've got an increased heart rate. You may have an increased white blood cell count. You may have an increased lactic acid. So there are, exams that we can do in addition to just talking to you about your symptoms to kind of come up with that systemic thing. But anyway, so definition of an infection is a bacterial invasion causing symptoms. Okay. I know it's very simple and there's, lots of stuff that can be said about it, but that's your simple definition. Okay. And then another interesting one, that will stump people is, what is shock? And I never even thought that it was all that hard of a question until my dad, who I may have mentioned before is a retired oral surgeon, told me that on his oral surgery board exam, his oral board exam, he got asked that question, and he was thinking, man, there's like books written about shock, and you want me to sum it up in one sentence? But actually, it's not hard to do. Shock is the inability to perfuse vital organs. Okay, now we see stuff in TV and the movies and all that all the time where they say, like, this guy's going into shock, and it just means that they're freaking out about something. Okay, but shock has a real definition: inability to perfuse vital organs. Why would you not be able to perfuse? Means get blood there. Okay, so why would you not be able to get blood to your vital organs? Well, an obvious one is hypovolemic shock. Okay, so that's you're losing blood. Trauma is the most common, but you can also have like a GI bleed or something. So if you're pouring blood out somewhere, well, there's not enough, water in the pipes to keep it going. So of course you're not getting blood to your kidneys and to your brain, and so you're not perfusing your vital organs. Okay. Another one is neurogenic shock. So you have damage to the spinal cord or to the brain that's causing some neurologic issues, and because of that, you're not perfusing well. Septic shock is another one. So I was kind of talking about that before. Septic shock, sepsis, is when the bacteria is causing these systemic symptoms. In that, so that means you've got an infection where the bacteria is doing so much damage to your body that your blood pressure is dropping, your heart rate's going up, and despite those compensations, you're not perfusing. So the blood pressure drops and your heartbeat increases to compensate for that, trying to keep the blood moving. But no matter how fast your heart's beating, you can't get the blood pressure up. That's septic shock, and people can die from that. So there's some others too, but that would be the major causes of shock. But if you're a medical student or you're a dental student watching this, and somebody ever asks you what shock is, easy answer: inability to perfuse vital organs. Okay, now we can talk at length about why you can't perfuse the vital organs, but we just defined it for you clearly. So I don't know. Thought those were interesting things to talk about. Definitely stuff that I have asked residents and students about before. And just fun questions that you can bore your friends with at the Super Bowl party this coming weekend. So anyway, this is Dr. Havercorn with River City Oral and Maxillofacial Surgery. You guys have a good night, and give us a call if we can help. Thanks. Bye.